A very good evening to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out first varicose culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in anti-rabies vaccine segment and present in around 50 countries. Three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abhairab in an eco-friendly pack. And with this, we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and totally revamped the facility and given private infrastructure to these government schools. And with our intervention, the strength of these two schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutrition supplement to over 1600 school-going children of Telangana and Tamil Nadu. And as we know, we are into field of rabies. We have tied up with FIAPO, Federation of Indian Animal Protection Organization, to make Thiruvananthapuram rabies free. You can visit our website www.indimmune.com. Our toll-free number is 1800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Insta, as well as Twitter. You can visit us at www.fearlessagainstrabies.com and www.pubertytomenopause.com. So, for our today's session, we have one very renowned expert, I would say, Dr. Gurpreet Kaur with us. She is one of the renowned gynecologists at Raipur. Welcome, Dr. Gurpreet. I would like to introduce you, first of all, to our viewers.
Hi, Rita.
Dr. Gurpreet Kaur is a renowned gynecologist practicing at Raipur, having over 12 years of rich experience into gynecology segment. She is the director of Kaur Multispeciality Hospital, Rajim at Raipur, and she is currently also serving as secretary of Raipur Menopause Society as well. Welcome, Dr. Gurpreet. And as Doctor, today's topic of discussion is postpartum healing and recovery. So, as we all know, Doctor, that going through this phase of pregnancy and then having a baby, and especially that time when a mother delivers a baby, and then she experiences a mix of pain as well as of joy of getting of seeing the baby. So, doctor, during the delivery time, we all know that stitches are something which definitely occur. So, doctor, can you just help our viewers to know more about, different types of stitches as well as, why we are discussing on this topic today?
Yeah, sure. Thanks, Richa. Thanks for nice introduction. Actually, postpartum period or postnatal period is a huge topic. We have many changes in postnatal period, the physical changes, the mental changes, the mother had to feed the baby, and then at home people think what we should give to eat, what we should not give to eat. She has delivered normally, she has delivered by cesarean. अब ऐसा करना है कि वैसा करना है. There are so many doubts here. So, but we'll stick towards the stitch care today. So, regarding stitch care, a baby can be delivered by cesarean. That means the incision is in the abdomen, or by vaginally. Vaginally, the stitches might be there, might not be there. If it is there, it is called as episiotomy stitches. So, mostly what happens is the abdominal stitches are there. If it is there, the people think that is a big operation and should be handled with care, and it is true. The abdomen is opened, and then it is stitches in 3 or 4 layers, and then the stitches which is seen outside is the people think that they should be taken care of, and yes, that should be taken care of. Vaginally, it is like aware of the hygiene, the perineal hygiene, and all those things. So, in details, if you want to ask about one by one, then I can answer that.
Definitely, Dr. Gurpreet. So, first of all, doctor, as you already told about cesarean as well as vaginal stitches. So, doctor, if you can give some more clarity on like what is the difference between both the kind of stitches we are given, and what kind of care I would say has to be taken for cesarean stitches separately and vaginal stitches separately.
Okay, so we'll come to the cesarean stitches first. So what happened is the abdomen is open and then stitched. So most of the time the stitches in the abdomen are removable sutures, but some people they put absorbable sutures also. So I don't prefer absorbable sutures in the abdominal cesarean deliveries. Why? Because they look good. They look good just after the surgery, that there is no stitches and nothing. But it takes, if you put absorbable sutures in abdomen, they give sometimes a bad scar. So I personally am very comfortable with the removable sutures. I do absorbable sutures also, but my personal experience with the absorbable sutures post delivery, 6 months or 5 months, they get a bad scar. And the people we stitch with the removable sutures, they get a very good scar. But the people, what they think is, आजकल fashion है, हमको stitch remove नहीं कराना पड़ेगा. But doctor, please put the absorbable sutures, they look good. But I just want to remove the myth that if you put absorbable sutures in abdomen, they give a bad scar, usually. And coming to the episiotomy thing, the episiotomy is usually absorbable sutures, they are not removed. And in cesarean, we usually call the patient after 7 days for the stitch removal, 7 days of the surgery. And the care that should be taken in abdominal stitches is they should keep it clean. let it be abdominal stitches or vaginal stitches. Vaginal stitches more, they should be taken care of because it is very near to the bladder and the anus, and anus is full of bacteria. So after every time when the lady goes to the toilet, they should clean the perineal region. जब भी वो बाथरूम जाते हैं उनको नीचे की जगह अच्छी से साफ करनी है. They can use Dettol or they can use clean water and soap, and they should clean it, keep it dry. They should keep it dry, and they can put some ointment or they can put some powder to keep it dry. Coming to the abdominal stitches, after taking bath, they should clean the incision side and keep it dry. And they can just put some neosporin powder or some ointment, and putting the powder, they can keep after stitches are removed, they can keep it open also. And then if the other cares, apart from the stitches, people should not strain. If they have abdominal stitches, abdomen should not be strained. If they have vaginal stitches, the vaginal stitches should not get strained. So in episiotomy, how do they get strained? The episiotomy stitches, उनको कैसे stitch को का जो खिंचाव है वो महसूस होगा? When they, if they are constipated, they don't eat well, and they are constipated, they push the pressure. That time they can just give away the episiotomy wound. And sometimes the ladies, they don't know how to sit and make the child drink their milk. So what they do, they just crisscross their legs and stitch. So the stitches, the perineal region is far. So that time when the strain is more in the vaginal region, they might just give away. The stitches might just give away. So during what I used to do was, while I used to stitch episiotomy, I used to tell what cares they should be taken. They should take after episiotomy. उनको नहाना है, अच्छे से उधर जगह को clean करना है, आलती पालती मार के नहीं बैठना है. When they sit, they should sit their legs straight and then crisscross their legs if they want. Not alti palti. They should not open that area wide. And coming to the abdominals, same thing. They should not have cough. They should not constipate, and they should not increase the intra-abdominal pressure, because the stitches we see in the skin are not the only stitches. We have stitches in the uterus. We have stitches in the rectus sheath. We have stitches. Some people, they stitch rectus muscle, peritoneum, and all those things. Everything should not be given up. Another thing I can tell is, for both patients, they can use the abdominal belt. Abdominal belt gives two types of support. The spine also gets supported, and the abdominal thing also gets supported. So anything else you want to ask?
Yes. So Dr. Gurpreet, मतलब normally कितना समय लगता है doctor stitches heal होने में, whether it is abdominal or it is vaginal?
So abdominal stitches तो हम 7 days पे remove कर देते हैं, but the internal stitches, it takes around 6 weeks to heal, and the vaginal stitches which are put, they usually heal by 15 days.
Yeah. So means डॉक्टर लगभग 15 से 20 दिन तक एक लेडी को प्रॉपर केयर करना चाहिए for herself, for the incisions. Yeah. So doctors, sometimes it is seen that some bleeding comes out from the incision area. तो ऐसा अगर हो रहा है मैम, if मतलब अगर ब्लड वहां से बह रहा है, सपोज इफ इन लोकल लैंग्वेज इफ आई से, तो फिर पेशेंट को क्या केयर करना चाहिए? शुड शी विजिट हर डॉक्टर इमीडिएटली, और शी शुड हैव अ बैंडेज और समथिंग? व्हाट कुड बी डन?
या देखो, एपिजोटमी साइड से अगर ब्लीड हो रही है तो दे थिंक कि ब्लीडिंग हैवी है, तो वी हैव टू रूल आउट कि इज इट द लोकिया दैट इज कमिंग, इट इज फ्रॉम द यूट्रस दैट इज कमिंग ब्लीडिंग, or from the stitch side. If it is from the stitch side, it is fresh, it is painful, after getting discharged from home, they should immediately go to their doctor and seek help. And if talking about the abdominal stitches, that is in cesarean, if bleeding is occurring from the cesarean wound, and that too after discharging, then also they should go to their doctor immediately. Sometimes what happens is, some people are flabby, fatty, or sometimes there is edema of the wound side because they were previously suffering from preeclampsia or high BP. So that time, if some ooze is there, then also they should go to the doctor and tell. We also give advice for such patients for edematous wounds, we give to take, we advise them to take high protein diet. वो अंडा ले सकते हैं, फिश ले सकते हैं, दूध पी सकते हैं, ये सब चीजें उनको बताएं से हाई प्रोटीन डाइट लेने से भी जो इडिमा होता है वो कवर हो जाता है. बट फ्रेश ब्लीड, yes, definitely they should go to their doctors.
Okay. Dr. Gurpreet, also in some cases it is seen that some swelling is there and pain is there for the stitches. So for these kind of things, what a patient can do?
See, pain will be there for 24 to 48 hours. Some people, it might be for 72 hours. But if pain and swelling is continuing for more than two days, then more so if they are having fever. Like if they are having fever, then the stitches are also swollen, the bleeding is coming or some discharge is coming. That means their wound has got infected, and then they should go to the doctor and seek the help. Mostly prophylactically, we give IV antibiotics in cesareans, and post IV antibiotics, we give oral antibiotics. Proper wound care, usually it doesn't happen, but if it has happened, some people, they go, they don't come back for suture removal, they don't change their dressing. Like if we have sent the patient without suture removal, we ask them to do dressing daily, clean that area, take bath, keep it dry, put some powder. If they don't follow, then some people, they get wound infected, and then that has to be taken care properly and by doctor only. They cannot manage it.
Yes, so for these kind of conditions, a lady should visit her gynecologist
Yes,
at the.
definitely.
Along with this, Dr. Gurpreet, कई बार पस निकलने का भी दिखता है, especially for the cesarean sections which happen. So sometimes ladies complain कि मुझे पस हो रहा है उस जगह पे and all. So what is the remedy for that, doctor?
देखो वही है, पस आ रहा है या वूंड में स्वेलिंग है या बुखार आ रहा है, these are the causes of postnatal pyrexia and has to be taken care very well. And there are some risk factors जिनमें ये हो सकता है, जैसे trial labors होते हैं, rural area I'm practicing there, so trial labors होते हैं, obstructed labor होते हैं, so those people they get infected, sepsis हो जाता है उनको, and some people they don't have sepsis but stitch area में उनको पस आ जाता है, that needs proper, they have not been taught about the proper hygiene, and if they have not done proper dressing at home, or if they have done dressing but not with the aseptic precautions, they might get that. Usually it comes down with the dressing and IV or oral antibiotics. So all these things, they should be taken care by the doctor and not at home.
Okay. डॉक्टर गुरप्रीत, जनरली ऐसा देखा जाता है कि स्पेशली द लेडीज हु हैव सिजेरियन सेक्शन, दे फाइंड इट वेरी डिफिकल्ट टू ब्रेस्ट फीड द बेबी because it is very difficult for them to manage that. So what you can give some tips to them or something which can ease and which can make them feel comfortable during that time?
Yeah, they basically need tender loving care. First of all, they have in their mind कि हमारा बड़ा operation हुआ, I should not get up, I need 4 people to make me sit down, and baby को feed कराऊंगी तो मेरे stitches पे दर्द होगा and वो stretch हो जाएंगे, so better I should not. So I want to say that कि breastfeeding is must for the baby and for mother also. It decreases her pain. It won't increase her pain. First thing, we should support her psychologically, that there won't be pain. Please feed your baby. If you feed your baby, your problems will come down. It won't increase. Second thing is the position they are feeding the baby. Back should be rested properly. They should sit straight. Put 2 pillows on the lap, and then put the head on the on your elbow का जो fossa होता है, this thing, cubital fossa, they can keep the baby's head, and with one hand they can support their breast, the other hand the baby should be supported properly, and moreover they are using the abdominal binders, and cesarean people, they can crisscross their legs and sit. This is for cesarean babies. And even episio patients, they have pain, so we tell them to support their back, sit properly, extend their legs, and position the baby properly. If they position the baby properly, their stitch won't pain. So the nurses which are there in the hospital, they help them. And personally, I got up after cesarean. I got up 17 hours after my cesarean. I took bath, I removed the catheter and I was walking. So that thing, I think, if you want, you can do it. If you want that you have to get up and take bath and you have to take care of your baby, you will do that.
Correct. Dr. Gurpreet, generally, what kind of medication or ointments do you prescribe to the ladies who have got incision?
So basically, if we use aseptic precautions, they really don't need antibiotics. But what happens is when we deliver the baby, when we do PV, when we examine the baby, so we might introduce some infections. So for first 3 days we give IV antibiotics for cesarean, and after that for 5 days we give them oral antibiotics. And along with that, the swelling of the wound should not occur, the pain should not be there. We give anti-inflammatory medicines also to them. And regarding this episiotomy, we give them the same antibiotics for 5 days. And locally, for episiotomy wounds, we give the betadine ointment or ointments which have antibiotics. And for abdominal stitches, after the stitches are removed, I usually prefer neosporin powder to be poured over the wound. So antibiotics and basically anti-inflammatory. That's it.
Thank you so much, Dr. Gurpreet, for giving your valuable time to us. And I could say, very pinpointed way you have told us what has to be done and what not, which will be really helpful for all our viewers. Dr. Gurpreet, if you permit me, I would like to take few questions. It has come up from our viewers.
Yeah, sure.
Doctor, one of our viewers is asking that should we eat spicy food after the surgery?
Yeah. I just wanted to add few things. I had mentioned this. I wanted to mention these things because we are taking care of only stitches thing. So people might not be might be thinking that what to eat, what not to eat, yoga करना है कि नहीं, exercise करना है कि नहीं, all those things. So मेरी एक line है what I used to speak to the patients. खट्टा मीठा, दूध दही, नमक टमाटर, अंडा चिकन, हल्दी मिर्ची, whatever they want they can have. Only thing is they should tolerate that. Not baby tolerate karega ki nahi, baby will tolerate everything, whatever you tolerate, baby will tolerate. So people think कि मुझे खट्टा नहीं खाना है, मुझे अचार नहीं खाना है, मुझे ये सब नहीं खाना है. It should not be there. They can eat anything and everything.
Yeah, especially the elder women who are there in the family, they always restrict कि नहीं अभी operation हुआ है, कुछ नहीं खाना है.
Even for doctors, they say. My mother also was like, don't eat curd, don't drink milk. It was like that. But it is proven that you eat whatever you want, even tomato soup, नींबू डाल के खाओ, that will heal the wound better than all those things which you are restricting to.
So we can say, Dr. Gurpreet, it's a kind of myth which is still there in Indian society, and doctors permit everything to eat. So which makes you feel good and healthy. Doctor, one of our viewer, Miss Pyle, is asking, how soon can a lady get back with her exercise routine after the surgery?
Yeah. So the only thing is 6 weeks it takes for cesarean to heal, and 6 weeks we take it as postnatal period. So I don't say that you should not do exercise. Simple exercises which don't strain the abdomen after cesarean, they can still do that. Like mostly lying down and doing the Kegels exercise. Kegels exercise is like if you feel like doing urine and you don't get the bathroom, and how you control. Urine जाना है but नहीं जा पा रहे हैं, you won't start micturating then and there. You will use your Kegels muscle to stop the urination. So from the first day you can start doing that. There is no problem in that. More so when the vaginal delivery occurs, the perineal muscles get really laxed, and so they can start from day one. And even for cesarean, some simple yoga exercises they can do, pranayams they can do for simple yoga exercises like the Kegels muscles exercises they can do from day one. And the heavy exercises I prefer for cesarean deliveries, they can resume after 6 weeks.
Okay. One more query is there, doctor, that after having vaginal stitches, when can a lady resume her sexual routine?
Yeah, sexual routine is
Kind of question,
totally,
which is really
yeah, they will be asking because it takes 15 days to just to heal the wound from there, but mother's body, it takes around 42 days, that is 6 weeks to heal. So
right.
it's better that, and more so if a person thinks कि अभी तो मैं दूध पिला रही हूँ, अभी तो मेरी डिलीवरी हुई है and I will not conceive. It's not like that. Some people, they just ovulate the next month and they might become pregnant. If the pain is less and you want to have an intercourse, you can have, but then you should use some contraceptive advice. Like best is during that time is condom. Moreover, the body is very weak for 42 days. So, external stimulation or external anything which comes inside the uterus might infect. So, I prefer after 42 days they can resume their intercourse, or if before, if they are comfortable, they want to do their body, they think that they are very energetic, they can resume, but they should be using contraceptives. सो 42 डेज इसीलिए बोलते हैं कि मदर को उसके मायके भेज दो. 42
Ah,
डेज शी गोज देयर. दैट इज द रीजन. बड़ों लोगों ने कुछ सोच के किया है.
yes.
Yeah.
Doctor, one more query is there. If a woman who is having the constipation problem, what diet you suggest if she is non-vegetarian? So,
If she is non-vegetarian, there are many good foods like oats, dalia, and you must be knowing people, mothers, they give dalia. Dalia khao, दूध ज़्यादा बनेगा. Dalia khao, लेटरिन कड़ी नहीं होगी, and all those things they say. So dalia, oats, papaya, munga, all those things, they increase the blood, they increase the hemoglobin, and they are high, rich in high fibers, so they will prevent constipation. More so if people with big episiotomy, we prefer giving stool softeners like lactulose. That is safe for mother.
right. Thank you so much, Dr. Gurpreet. As of now, we have these many queries. So, if we get more queries, I will definitely get back to you for that.
Yes. I
Uh,
just want to conclude with the things that postnatal period is even more stressful than antenatal period. Antenatal period, they are happy that they will be giving birth to the child. But the postnatal period, they need physical support, they need mental support, they need care of their own body, baby. They should take care of their breast. Breast should be soft. People, they don't tell to support their breast. They mothers say don't wear bras and don't support your breast, so they get sagging breast. Then they come ki after childbirth my figure is lost and all those things. So proper breast support will prevent breast engorgement, and if breast engorgement is happening, they should express their milk out and just discard it, or if it is pouring extra, they can feed some other baby. The second thing, wound thing, we have discussed very well. Fever, they should not get in postnatal period. Fever is an alarming sign. They should look for why they have got the fever. They should rule out urinary tract infections. Yoga and exercise is a totally a different topic. We can take it sometimes. I can show some videos. I can demonstrate also, and we will have that thing some other day. Yoga and exercise, definitely I say, because once a mother becomes a mother, they should not think that their life is gone, their beauty is gone, their mental peace is gone. It should not be like that. So yoga, meditation, exercise will help them get back to their youthful phase, and taking care of their baby will be improved. They should not think कि मेरा तो अभी बच्चा छोटा है, मैं कैसे योग करूंगी, मुझे कहाँ टाइम मिलेगा. Any time they can do few asanas and they will get relieved of it.
yeah.
Yeah.
Definitely, Dr. Gurpreet, and thank you so much, ma'am, for your valuable time and coming over here for the live talk session. We talked to you and giving your expert advices.
Even I had a very nice time. Thank you so much.
Thank you so much. Thank you so much to all the viewers from our team side. We talk do you as well as www.pubertytomenopause.com. You can always visit this website for more and more information on all age groups of women and the diseases associated with the womanhood, I would say. So, till then, take care of your health and take care of your nutrition as well. Have and adapt a healthy lifestyle. Thank you so much.
Thanks.